Hi, I'm David Edis, orthopaedic spine surgeon at Victorian Orthopaedic Spine Service. I'm going to talk to you today about spinal fusion and the concept of spinal stiffness after surgery. So, does spinal fusion limit mobility? This is a common question I hear asked by patients having surgery. Well, the spine has many motion segments. In fact, it has 26 motion segments in most patients. Spinal fusion typically only involves restricting one or two of these segments with the surgery. And oftentimes that level is fused, the fused level is actually already damaged, and it often is actually stiffer than normal anyway. The other important concept is that pain restricts motions in the spine. And so this restricted motion in other areas of the spine is often due to reflex muscle tension from the pain. And so pain causes stiffness, and if we can relieve the pain that's coming from these damaged areas, then in fact we can actually restore motion after even a spinal fusion. And very interestingly, most patients, particularly if they're only having one or two levels fused, do not complain of a worsening of their spine stiffness following a one or two level fusion. Now, naturally, if patients are having a longer fusion, they will have significant restriction of the motion of the spine. And in severe and complex deformity of the spine, it is often out of balance. And to achieve balance, the fusion may need to extend over many levels, such as in the example in my x-rays here. So you can see on the left that prior to the surgery, there had been previous surgery done at the lower end that didn't correct the deformity. It was a fusion, but it didn't help the patient because she was still in significant unbalanced position. That was revised to a longer surgery that corrected the deformity, and in fact her mobility and her comfort levels improved significantly after that. And this is what we typically find if we can achieve balance. And this can be quite durable. Of course, it's expected that in these cases the spine will feel stiffer than normal, but overall the physical function should be improved. So the key is hip movement. So if hip movement is maintained, then this typically allows patients to bend forwards even if they have a stiff spine, because most of the movement does occur at the hips, as in this cartoon. When the hips develop arthritis, they lose mobility, and this can be very disabling to someone with a stiff spine. And it will aggravate any back pain problem. So hip motion needs to be evaluated before any spinal fusion, and as you saw in the previous x-ray, that patient had both her hips replaced before she had a spinal fusion. And I think that's a good idea.